also part of what we're thinking about in terms of using sensors to monitor meaningful, purposeful movements and get a sense of how well people perform that movement and how often they do it. And so one idea here would be that we would use movement monitoring as a kind of biomarker for how you're doing with your disease. So if you're in congestive heart failure, or you have chronic lung disease and you're always gasping for oxygen, and you start to decline a little bit, it may be that we will have sensors that can check the oxygen in that person, or check the heart rate. We can check the weight of that patient if they're retaining fluid with heart failure. But if we could also add into that little algorithm of whether or not someone is worsening and catch them before they end up in the hospital, maybe we can also look at their typical level of activity from day to day. Is that declining too? And that would tell us that they're more fatigued, more short of breath. It's more effortful to do their activities. And that can be combined with this other sensor data and clinical data to send out a note to their physician and say, you know, Joe is not doing well. We need to call Joe before he ends up in the emergency room. This may work especially with this new rule from Medicare, where hospitals are now responsible for the 30 days post-discharge of their patients. Now, hospitals aren't ordinarily involved in discharge care of their patients. I mean, doctors are. But now it's falling on the hospitals and the doctors who manage their patients. So we'd like to be able to maybe monitor those really ill people and again use their levels of activity